Hi, I'm Dr. James Cannon of Dental Sleep Medicine of Sarasota, here to talk about the anatomy of obstructive sleep apnea. In other words, what causes sleep apnea and why are some people more predisposed to suffer from it? The tongue is the culprit in all of this. It is a muscle and is critical to chewing, tasting food, and normal speech. During waking hours, the tongue maintains its position to ensure the airway remains open. However, at night, our brains drift into deeper levels of sleep and our muscles relax nearly to the point of paralysis. The tongue is no exception, and particularly if we sleep on our backs, gravity will take over and the tongue will collapse backward into the airway and obstruct it. From the anatomical photo, you can see a side view cross-section of the head and neck. I show you this to illustrate the size of the tongue, which I'm encircling right now. Most people only think of this portion of the tongue. With good reason. This is where our taste buds are and helps us form our speech. However, this portion is about 1/3 of the total size of the tongue, and it is the other 2/3 that obstructs the airway during sleep. You can also see how small the upper airway is, and it's no wonder why sleep apnea is so prevalent. The other reason to use this photo is to illustrate how the tongue is attached to the lower jaw. This is the lower jaw here. This would be the tip of the chin, and your lower teeth would be right in this area. So the tongue attaches to the inside of the lower jaw. It is this fact that allows dental device therapy to be successful. By holding the jaw forward, the tongue is pulled forward out of the airway. This diagram has been digitally modified to show how moving the jaw forward opens the airway. So what happens when the tongue closes the airway? Well, oxygen can no longer reach the lungs, which is a pretty big deal to the body. As the blood oxygen level begins to drop, the body begins to react quickly. Stress hormones are released to stimulate the brain to come out of the deeper sleep state and to take a breath. Heart rate and blood pressure rise, which can be very dangerous while sleeping. When the brain comes out of the deeper sleep state, the tongue tightens up, opening the airway. An audible gasp or choking sound is typically heard by the bed partner. At this point, air is able to make it to the lungs, blood oxygen level rises, and all is great until the tongue begins to relax and close the airway. This process repeats itself hundreds of times per night. Yes, hundreds. All the while putting a tremendous strain on the heart and cardiovascular system and never allowing the brain to enter a deep, restful sleep state. I hope this video explains how the tongue is the culprit with sleep apnea and how dental device therapy can bring the tongue forward and out of the way for more healthy, restful sleep. For more information, please check out our website, dentalsleepmedicineofsarasota.com, or call 941-266-4646. Thank you.